Welcome back, everyone. Did you know that about 6.5 million adults are now living with congestive heart failure? And that number is expected to go up, which is a scary thought. So joining us now is Dr. Scott Blois to talk more about how you can stay safe. Thanks for being here with us.
My pleasure. Thank you for having me.
Okay, let's start off with what is congestive heart failure?
Well, there's about 20 different things that can hurt the heart muscle, but congestive heart failure is a term when really the heart muscle is not strong enough to pump blood to the body. And there are many different things that can cause it. Probably the two most common in America is uncontrolled high blood pressure, and then when you get cholesterol blockages in your heart arteries and get a heart attack. But there's a lot of other ones that can cause it.
Yeah, it's kind of an overarching term that can mean so many different things.
Correct.
How do you know? What are the symptoms and the signs if you possibly have this?
That's a great question because, as you said, a lot of people in America have heart failure. In fact, it's estimated that about 1 in 5 people will develop heart failure during their lifetime. Some of the most common symptoms are just fatigue. The heart's not working well, so you're tired. But also the lungs start to fill up with water, so congestion and shortness of breath. And then lastly, swelling. A lot of times if you're starting to swell in the legs or in your abdomen, it can be the body starting to fill up with water because the heart's not pumping well.
So do you just need to listen to yourself and kind of know when things don't feel right, go to your doctor?
Yes, very much. And these symptoms, tiredness, congestion, there are other diseases that cause it just as much.
Sure.
But if you're not getting better and you have high blood pressure or you've had cholesterol problems, people say, then I think if you're not getting better, talk with your doctor about could this be congestive heart failure.
Okay, so what are the treatment options that are out there for someone?
Well, that's one of the reasons. There are many different types of heart problems in cardiology, but congestive heart failure, which I got interested in and have extra training in, it's not a death sentence. You get on the internet and you look at congestive heart failure and the statistics are pretty scary.
Sure.
But actually there's been a lot of medicines and research that's been put into heart failure in the last 30 years. And medicines, simple lifestyle changes such as watching the amount of salt you have, not smoking, decreasing the alcohol consumption, getting some regular exercise, all of those are very important things in congestive heart failure besides the medicines that have been developed in the last 30 years.
Yeah, all good things, and just get with your doctor.
Yes, very much. And we want everybody to have a long and happy and healthy lifestyle. We know with congestive heart failure, the earlier you know you have it, you can get put on medicines, your prognosis is better.
Okay, that sounds good. Thank you so much for being here with us on this Monday.
Thank
Katie, you know, one of the best ways to get out there and get some exercise, today's a beautiful day to do so.